Welcome to the Mentor mini-series on teaching scripts and chalk talks. Episode 3, Take-Home Points. Imagine you're preparing a chalk talk and you've chosen your topic, pulmonary embolism. Now what? There's a lot you could teach on this topic. How can you possibly teach on this effectively in a 3-minute teaching script or a 15-minute chalk talk? Take-home points are the foundation of teaching scripts and chalk talks. Without them, your teaching will crumble into an indiscernible mess. For your teaching to be clear and discernible, it must be built around well-crafted take-home points. So, what exactly are take-home points? They are selective, pithy teachings. Simply put, they are the most important points you want your learner to remember. They are what you want your learner to take home with them when they walk away from your teaching. In this video, we'll learn the following about take-home points: what they should focus on, the optimal number of take-home points, and how take-home points differ from learning objectives and intended learning outcomes. Within a single teaching script or chalk talk, the take-home points can all be focused within a single domain, like management, or can span a broad range of domains. Let's go through a few examples of take-home points someone could choose for a chalk talk on pulmonary embolism. Here is one example of take-home points that can be used for a talk focused entirely on management. Number 1. The definitive management of high-risk PE is catheter-directed thrombolysis or surgical pulmonary embolectomy. Number 2. Intermediate-risk PE should be admitted to the hospital for monitoring. Number 3. Low-risk PE can be discharged from the ER on systemic anticoagulation. And an example for a teaching focused entirely on risk stratification. Number 1. Risk of decompensation from PE can be thought of along a spectrum: low, intermediate, and high risk. Number 2. High-risk PE is defined by hypotension, specifically sustained hypotension or shock. Number 3. Intermediate PE does not have sustained hypotension, but the patient has features that increase risk of decompensation based on medical history or vital signs, as defined by the Pulmonary Embolism Severity Index. And here is an example of take-home points with a broad overview designed for clerkship medical students. Number 1. The definitive diagnosis for PE is made by CT-PE. Number 2. All PEs are treated with systemic anticoagulation. And number 3. High-risk PE, those with hypotension or signs of end organ damage, are additionally treated with emergent catheter-directed thrombolysis or embolectomy. You may have noticed that in each example there were only 3 take-home points. This is because take-home points must be limited in number. As an educator, we must resist the urge to deliver a deluge of knowledge to our clinical learners. Too often, this overwhelms their capacity to learn and remember. Instead, deliver frequent, concise teaching scripts or chalk talks, each with a limited number of take-home points. How many take-home points is too much? Depending on the complexity of knowledge, a single take-home point may be appropriate for a 5-minute teaching script or even a 10-minute chalk talk. And at maximum, you should not have more than 3 take-home points in 5 minutes, or more than 5 take-home points in any duration of talk, even a 30-minute chalk talk, for example. Importantly, before we summarize what we've learned, I want to review a key distinction. If you are familiar with education lingo, you may be wondering, but what about Bloom's taxonomy and the creation of learning objectives or intended learning outcomes? These can be valuable, but developing teaching scripts or chalk talks is not the same as developing a curriculum or even a lecture. It takes a different tool for a different task. Focusing on learning objectives runs the risk of inadvertently causing you to overteach during short teaching sessions. To review, take-home points are the foundation upon which your entire teaching scripts and chalk talks should be built. Take-home points can focus on the clinical presentation, differential diagnosis, diagnostics, management, or common pitfalls. And within a single talk, the take-home points can be focused on only one of these domains or multiple domains. Importantly, take-home points must be limited in number to ensure we do not overwhelm our learners. Finally, the beauty of take-home points is in their simplicity. Make them intentionally focused and concise. Teach less to teach more. Happy teaching!